Hi everyone, in this video I'll be discussing some of the important adverse effects of anti-cancer drug in a single image. So that image will give you a very good idea what are the adverse effects of anti-cancer drugs. So we have taken the chemo man and I'll be telling you what are the adverse effects we see here. Now, so the first important problem what we need to understand is the ototoxicity. So the drug which causes ototoxicity, can you tell me what drug can cause ototoxicity? The platinum compound, what is it? Cisplatin can cause ototoxicity. Correct. Now, when you stimulate the vestibular apparatus, nausea and vomiting, I'm just telling you it's not because of stimulating vestibular apparatus. They can cause nausea and vomiting anti-cancer drug. And who can cause that? There are three C's which can cause high nausea and vomiting. What are the three C's? One is cisplatin, one is cyclophosphamide, and one more C is chlorambucil. So these are highly emetogenic anti-cancer drug. Now they can ask you what is the drug of choice for early CALV. Yes, it is Cetron 5-HT3 blocker. Late CALV, it is the Pitant. So they are neurokinin 1 receptor blockers. Now patient may develop the mucositis. So how do you prevent mucositis? The drug that is used to prevent that is called palifermin. Palifermin is a keratinocyte growth factor which is used to prevent the problem. Now the patient may develop dermatitis and that is called flagellate dermatitis. Now you have to tell me what drug is known to produce that. Yes, you are right. It is called bleomycin. The next important is what drug will cause the toxicity of the lung. The pulmonary toxicity. Remember, bleomycin can cause that. Another drug which starts with the same B, it is called busulfan. So these two drugs are known to produce the lung toxicity, pulmonary toxicity. Now, what drugs will cause cardiotoxicity? There are two important cardiotoxic drugs. One is the MAB called trastuzumab, and we have one more, and they are called anthracyclines. Anthracyclines like daunorubicin, doxorubicin, they can cause. How to prevent? To prevent anthracyclines induced cardiotoxicity, what we use? We use iron chelator. What is the name of it? Dextrazoxane. It is called dextrazoxane. Now, a drug can produce non-cardiogenic pulmonary edema. So, what is the name of the drug which can produce this? And that is called cytarabine. The name is called cytarabine. Now, coming to the stomach. Stomach, there may be GI bleeding, gastrointestinal bleeding, and also a drug which causes this GI bleeding most common is methotrexate. It can cause GI hemorrhage. Now, what is the antidote for methotrexate? Is a commonly asked question in exam. The antidote is, yes, take a guess. It is called folinic acid. What are the other name for folinic acid? It is also called as leucovorin, also called as citrovorin. There is an enzyme for that, and that is called glucarpidase. So we can use that. Now, in the GIT, patient may also develop a problem that is diarrhea. Now, how do you manage diarrhea? The treatment for cancer drugs induced diarrhea, that is anti-cancer drug induced diarrhea, is loperamide. So that question has also been asked. Now coming to the bladder, you can see the kidneys here. The bladder. So in the bladder, the problem they ask you is a condition called hemorrhagic cystitis. Now, can you tell me what drug is responsible for that? The drug responsible for that is cyclophosphamide, and one more drug is called ifosfamide. Now, who is the culprit? The metabolite of cyclophosphamide is acrolein, and that is going to cause this. How do you prevent? To prevent, we use something called mesna that is used to prevent that problem. Now you can see in the diagram the hand and foot. So there is a syndrome called hand foot syndrome. Now what drug is known to produce hand foot syndrome is the 5-fluorouracil capecitabine tegafur and a drug pemetrexed. So these are commonly known to produce hand-foot syndrome. Now again in these patients there is a problem called radiation recall. So radiation recall syndrome. Can you guess what drugs can produce that? That is done by anthracyclines. So what are anthracyclines? The don and doxorubicin, they can produce that. Now again you take the example of the upper and lower limb. So in that there is a neuropathy called peripheral neuropathy. Peripheral neuropathy affecting the periphery. And that is done by the Vinca alkaloids like vincristine. Vinca alkaloids, not only that, even taxanes can do that. Peripheral neuropathy. Now moving on to the next one, you can see the kidney here. So kidneys, what drug can damage the kidney? Mainly it is cisplatin. So majority of our question is based on cisplatin. Cisplatin can cause nephrotoxicity. Now how do you avoid cisplatin-induced nephrotoxicity? One is by using amifostine. One more by forced chloride diuresis. So these are the methods to prevent that. Now you can see the liver. What drug is hepatotoxic and what drug comes to your mind? The main drug which should come to your mind is methotrexate. Methotrexate can cause hepatotoxicity, and one more is 6-mercaptopurine. So that also start with M. Now coming to the bone marrow. So bone marrow, most of the drugs what we use, they are bone marrow suppressant. Now what is the bone marrow sparing drug? So most of the anti-cancer drug, they suppress the bone marrow, but there are bone marrow sparing drugs. Now there is a drug which can produce sustained neutropenia. That means the neutrophil count comes down, and these group of drugs are called as nitrosoureas. Nitrosoureas, and they end with mustin, carmustine, samustine, like that. Bone marrow sparing drugs are the VBL drugs. V for the vincristine, B for bleomycin, L for L-asparagines. They are bone marrow sparing drugs. Coming to the brain. In the brain, the drug which is neurotoxic is ifosfamide. So ifosfamide is neurotoxic. Now another problem is in the cerebellum. So cerebellum, let me write here, cerebellar ataxia. Can you guess what drug produces cerebellar ataxia? The name is called cytarabine. Cytarabine. See, you can see one image, you can get all the information related to this, and this is a commonly asked question for you. And please remember, when there is bone marrow suppression, we use the grastim or gramostim, or we use erythropoietin, or we use the interleukin 11 analog, that is oprelvulkin, to correct that bone marrow suppression. So most of the anti-cancer drugs, they suppress bone marrow, but there are some bone marrow sparing drugs. So I hope most of your questions can be answered from this chemo man, and we have tried to give all these things at one place. Okay, so if you get any other information, try to add to this image, and that will make your preparation fantastic. So with that, that is about the adverse effect of anti-cancer drugs in a nutshell. Thank you all.